In women who are eligible for breast-conserving treatment, I'm often asked the question, gee, Dr. Harness, would I be better off if I had a mastectomy? Now, there's an important recent paper out on this very subject. It comes in March of 2012, and it comes from the journal Cancer, and I have it right here. And it's called Survival After Lumpectomy and Mastectomy for Early Stage Invasive Breast Cancer. Now remember, early stage invasive breast cancer is stage 1 and stage 2. This is an important study from a dear friend of mine, Dr. Shelley Wong, who is now at Duke University. The registry data that was looked at here was the California Cancer Registry. They looked at data from 1990 through 2004 for 15 years. And the question was, is lumpectomy or mastectomy, are they the same, one better or worse than the other? Now, we've known for many years that there's been equivalency between mastectomy and lumpectomy as far as overall survival goes. As I tell women all the time, if we save the breast, then there's a chance the cancer can come back in the breast. But that hopefully then does not impact overall survival. So we've known for 25 years or longer, actually, that there's no difference in long-term survival. So what made this particular study somewhat unique? Well, it had an interesting finding. And the finding was that women who were older than age 50, who had estrogen receptor positive breast cancers, actually did better than women who had mastectomies. And the reasons for this are not really clear, but the facts stand for themselves. So how then does an important study like this influence you? And the answer is, it's an important piece of information, and you can take it in, but there are no guarantees associated with this for your individual case. Please remember that breast cancer is a galaxy of diseases going from very, very benign acting all the way over to super aggressive acting. Often in a study like this, women who had a little bit larger tumors or a few more nodes positive perhaps got to mastectomies. But the reality was that the women who were 50 or older and had estrogen receptor positive cancers actually had a little bit better overall survival. Now, a study like this should not be the final factor in influencing your decision about lumpectomy versus mastectomy. Remember, there are advantages to each. There is no perfect solution, one over the other. With lumpectomy, you need radiation therapy. There are some exceptions to this in women who are 70 and older, but in general, you always need radiation therapy. And because the breast is there, you've got a small chance each year that the cancer can come back. With mastectomy, you lose your breast, you lose sensation, but indeed we have better ways of performing reconstruction now, including nipple-sparing mastectomies. Now, when you're considering lumpectomy, please remember that there are different options when it comes to the radiation therapy that you need. And hopefully you're near a location that even offers intraoperative radiation therapy that in the US at least is done under a protocol as a single one-time treatment in highly selected cases, or the intraoperative radiation therapy can be used as a boost followed by either 3 or 5 weeks of radiation therapy. The bottom line is always, please be working with a multidisciplinary team. The nice thing about Dr. Wong's study is there's certainly no inferiority across all age groups when it comes to choosing a lumpectomy. But the key to this is to be with a multidisciplinary team. The key is the appropriate and proper radiation therapy plus the other adjunctive therapies. Hopefully you'll find this information helpful to you in your decision-making process. The Mobitron is a mobile, self-shielding linear accelerator used to deliver intraoperative electron radiation therapy for the treatment of breast and other forms of cancer. To learn more about this exciting and cutting-edge technology, please go to intraoperativemedical.com.